Clostridium botulinum is a gram-positive, rod-shaped anaerobic bacterium. It forms heat-resistant endospores, which is one of the main reasons botulism is such a serious food safety concern. It produces botulinum toxin, and if you aren't aware, according to the CDC, that is the most potent biological toxin known. It is found in soil, sediments, dust, agricultural environments, and improperly processed foods. All right, buckle up. We're about to talk about the bacteria that invented paralyzing people before Botox made it trendy. Clostridium botulinum produces 7 neurotoxins: A, B, C, D, E, F, G. But only A, B, E, and sometimes F make humans sick. Types C and D mostly affect animals, and type G shows up basically never. This information may seem complicated, but the summary is A is the overachiever. It poisons humans and makes them prettier. Clostridium botulinum does not normally live in or on people. Instead, it naturally lives out in the environment, especially in places where there is little or no oxygen. It's commonly found in soil and dust, lakes, rivers, and ocean bottoms, farms and agricultural areas, animals' intestines, and root vegetables that grow in soil. Clostridium botulinum mainly exist as heat-resistant spores. These spores are like tiny survival capsules that can live through boiling temperatures, drying out, and harsh chemicals, which is how they survive the environment. Because the spores are so tough, they can easily move through soil, dust, and water, and they can end up on food if the food isn't handled or processed properly. Virulence factors are traits that help a microbe cause disease. With C. botulinum, the bacteria itself doesn't attack your tissues. The toxin it makes does the damage. Bont is the primary toxin of C. botulinum. It is considered the most potent biological toxin known, capable of causing severe disease even in extremely small amounts. Bont works by blocking acetylcholine, the neurotransmitter that allows nerves to signal muscles to contract. When the signal is interrupted, muscles become unable to move, resulting in flaccid paralysis. If the paralysis spreads to the diaphragm, it can lead to respiratory failure, which is the most life-threatening complication. Clostridium botulinum causes one main disease, botulism. However, botulism comes in different forms, depending on how the toxin enters the body. There are no known FDA-approved vaccines for botulism. Infant botulism can occur when babies swallow spores, which then grow and make toxin inside their intestines. The most common cause of this is honey. That's why you always hear babies under 1 should not have honey. Some of their symptoms can include constipation, poor feeding, excessive sleepiness, weak and altered cry. The baby may become lethargic, and more advanced symptoms could include generalized muscle weakness and breathing problems. Infant botulism is treatable when recognized early. Babies usually recover completely with proper care. The gold standard treatment for infants under 1 year of age is called Baby Big. This is a medication made of special antibodies that neutralize the toxin, which stops the toxin from causing nerve damage. Foodborne botulism comes from eating food that contains the toxin. People most often get foodborne botulism from home canned vegetables, improperly jarred salsa or tomatoes, and improperly stored leftovers. Botulism symptoms usually start with the eyes and face first because the toxin hits the shortest nerves before the longer ones. That's why early signs include drooping eyelids, blurred vision, and trouble speaking, and then it spreads downward. More severe symptoms include muscle weakness, difficulty breathing, and respiratory failure, which can become life-threatening. Antitoxin is the most important treatment, HBAT. While this doesn't reverse paralysis, it stops the toxin from getting worse and prevents further nerve damage. Adult intestinal botulism is similar to infant botulism, but occurs in adults with gut issues or disrupted gut flora. It's very rare, however. Adults who get this usually have gut damage, abnormal gut bacteria, recent antibiotic use, GI surgery, or conditions that change their digestion. Wound botulism can occur when spores get into a deep wound and produce toxin. The most common cause is injection drug use, such as black tar heroin, and deep traumatic wounds. The symptoms and stages for both adult intestinal botulism and wound botulism are the same as infant and foodborne botulism. However, with wound botulism, you may notice signs of the wound itself. The wound would look infected, redness, swelling, drainage, and pain at the wound site. Dr. Jean and Dr. Alistair Carruthers are two married doctors who first realized Botox could smooth wrinkles. In the 1980s, Dr. Jean Carruthers, an ophthalmologist, was using Botox to treat patients with blepharospasm. One day, a patient came in telling Dr. Carruthers that she loves the treatment, but asked if she can keep giving her the Botox because it helps her frown lines go away. Dr. Carruthers was confused and asked, "Frown lines?" But when she looked closely, she realized that the patient's glabellar lines had smoothed out dramatically. She told her husband, who is a dermatologist, and he immediately recognized the huge cosmetic potential. They began formal research, and by 1991, they published the first scientific paper on the cosmetic use of Botox. Botulinum toxin is so potent that a tiny amount can cause paralysis, yet when purified and used safely, it becomes Botox. Botox equals botulinum neurotoxin type A, the exact same toxin that bacteria produce, but it's extremely purified, extremely diluted, and it's injected in tiny controlled amounts. It doesn't spread through the whole body. Botulism causes paralysis because the toxin blocks the chemical that makes muscles contract. Botox uses that same effect, but on purpose. It relaxes wrinkles, softens frown lines, treats migraines, reduces sweating, stops jaw clenching, and can help with muscle spasms. In botulism, the toxin spreads through the bloodstream, which leads to full body paralysis. With Botox, the toxin stays where it's injected, which leads to controlled muscle relaxation. Botox has been FDA approved since 1989, first for eye muscle spasms, and then around circa 2002 expanded to cosmetics, migraines, sweating, and many other uses. I could use some work on my glabellar lines.